We have husbands being denied access to maternity hospitals with their wife unless they have the pass. And ultimately, we have officially reached full-blown senseless screeching hysteria as regards this virus. This is Ben Scallon and you're watching Gript Media. Now, if you're a pregnant woman going into hospital and you want your husband to be there with you, he had better have his pass or he's not getting in. As seen on the Rotunda website, the National Public Health Emergency Team, that is to say NPHET, has recently recommended that the pass or certificate be adopted as a requirement for visitation to healthcare settings. With this in mind, nominated companions visiting the hospital will be requested to provide their pass as a part of our safety screening process at our front entrance from 1st of December. Similarly, if you want to visit your mother in the nursing home, you'll have to present a pass as well. Now, maybe this appears reasonable at first glance. As we all know, and have known for quite some time now, if someone is older, they are generally more at risk from the bug. Nothing new there. Because nursing homes are by definition full of older people, it stands to reason that extra care needs to be given to those residents and that there should be special measures in place to keep them safe. All of that makes perfect logical sense. And the same goes for pregnant women, of course. We all want to make sure women going through pregnancy are healthy along with their lovely little babies. So surely a pass in these settings makes sense, right? Well, where the logic falls flat here is when you pretend that the cert has any significant bearing on the threat to someone else's health. The fact is, it doesn't, and the numbers demonstrate as much. The cert was introduced on the 12th of July, and as you can see from the chart here, cases have trended upwards ever since it was introduced. It has not reduced the number of cases. On top of this, deaths have also trended upwards since the policy was implemented. For the sake of saving this channel from deletion by the social media fact-checking teams, I'd like to stress that I'm not talking about whether any medicine, treatments, or the rollout is effective here. I'm talking about the passport specifically and saying that the numbers show the government's cert policy has not reduced cases since July 12th. That's all I'm claiming, nothing more, nothing less. So with that said, why hasn't the cert worked exactly? Well, according to NPHET, people who have received both doses carry a similar viral load to those who have none. The BBC even reports that people with 2 doses can spread the bug just as easily in household settings as those who don't have any. Now, I'm not saying that, I'm not a scientist and it's not for me to speak on these things, but this is what NPHET and the Western state media is telling us. Waterford City became the biggest viral hotbed in the country after the rollout covered 99.7% of the country's adult population. Yes, of course people will bring up the fact that evidence seems to indicate that people who took both doses and who get the virus are likely infectious for a shorter period of time. Sure, that seems to be the case. But it's also irrelevant to this issue. It doesn't matter if you're infectious for 5 minutes or 5 weeks. If you have the virus and you walk into a nursing home, dosed up or not, there's a very real chance that you could spread the bug to other people. Your medical status seems to have very little bearing on your risk to others in that precise moment. And that is where the risk from this policy comes in. It's quite conceivable that double-dosed individuals could be lulled into a false sense of security wherein they think, well sure, I don't have to be careful here, I'm covered. Saunter in without a care in the world and inadvertently kill their own grandpa. This cert policy is not helping anyone and has the potential of making things even worse. We are experiencing such hysteria at a societal level that people aren't thinking or using their brains anymore. With all this talk of double doses and booster doses, what we need is a healthy dose of cop on. Please like and share this video, and if you enjoyed it, please consider signing up for a monthly donation via the link on screen to help us produce more content like this. Alternative media like Gript needs all the assistance it can get, and every donation goes a long way. As always, thanks for watching.